Hello, and welcome to today's Expert Insights webinar series from Wolters Kluwer. Before we begin today's session, we'd like to cover a few housekeeping items. The session is being recorded and will be made available to all attendees. Your lines have been muted to minimize background noise during the presentation. We encourage you to submit a question in the Q&A box at any time during the presentation. Your question will be addressed during the Q&A session. Should you need technical assistance, as a best practice, we suggest you first refresh your browser. If that does not resolve the issue, please type your issue in the Q&A box and a technical representative will reach out to you directly to provide assistance. We will now begin the webinar. Vikram, over to you.
Thanks very much, Connie, and thank you very much to our audience for joining our Expert Insights webinar series. I'm Vikram Savkar, General Manager for the Medicine Business at Wolters Kluwer, and I'll be your moderator today. Even before COVID-19, it was a time of significant ferment and innovation in the medical world more broadly, and the medical education world as well. Availability of new technologies such as virtual reality and artificial intelligence, changing demands of consumers and students in a digital age, and shifts in public policy and investment have all combined to create an environment in the medical world of continual exploration and experimentation. The COVID-19 crisis has added significant urgency and momentum to these activities. It's clear that the pace of innovation will and should accelerate in the coming years. This webinar series is designed to help socialize these emerging ideas across the community. Our program today will be focused on a timely and important issue in the healthcare community and an aspect of innovation that doesn't turn so much on technology, but on human engagement, managing post-pandemic stress and anxiety. I'm delighted to welcome our guest today, Dr. Samoon Ahmad, Professor of the Department of Psychiatry in the NYU Grossman School of Medicine, Unit Chief of Inpatient Psychiatry at Bellevue Hospital Center, and the founder of the Integrative Center for Wellness. Dr. Ahmad supervises and mentors trainees, writes on a broad range of subjects, and lectures nationally and internationally on various topics. He's also, to our great pleasure, the author of a number of clinical textbooks with Wolters Kluwer, including Medical Marijuana, a clinical textbook. He is the new revising author of Kaplan and Sadok's Pocket Handbooks of Clinical Psychiatry and Psychiatric Drug Treatment, and he is currently working on a new text, Coping with COVID-19, Medical, Mental, and Social Consequences of the Pandemic. Today, he will discuss the long-term impact that stress can have on one's physical and mental well-being, and also provide some tools that individuals can use to evaluate their own level of well-being and improve their levels of wellness. I'm very pleased to have Dr. Ahmad join us to speak on this topic today. And with that, Dr. Ahmad, please take it away.
Thank you, Vikram. I appreciate that. Let me begin by saying that there is no doubt that living through the COVID pandemic has been challenging. And even for those, I think, who did not contract the disease, the experience during the pandemic has been extremely difficult, especially for essential workers. There was just recently a poll released this year that found that over 60% of healthcare workers say that their mental health has suffered because of the pandemic. And for workers actually who have been working remotely, their stress is often revolved around social isolation, juggling their jobs, domestic responsibility, as in fact, even working more. And at the same time, an estimated 10% of those who had COVID-19 went on to develop long COVID or so-called long haulers who are reporting symptoms even at this point. So the question is, how are we coping? And the honest truth is, not well. In fact, an Italian study showed that about 30% of patients with severe COVID infection met the criteria for post-traumatic stress disorder. And as many as, I would say, about a third of patients are reporting neurological or psychiatric symptoms even 6 to 7 months after the initial infection. And an average share of adults who are reporting symptoms of anxiety disorder or depressive disorder has risen to about approximately 30 to 40% since late spring of last year. And that's about a threefold jump when you compare that to the first 6 months of 2019, when the number of adults experiencing these symptoms was sort of holding steady, which has been the average around 11% or so. And the trend is, in fact, no different when you isolate for anxiety or for depressive disorders. Now, in addition to this, people who are experiencing anxiety and depression, extremely important to talk about substance use, because 23% of adults reported drinking more. And additionally, I would say about 60 to 62% said they've experienced some undesired changes in weight. And of those who have gained weight, an average has been about 29 to 30 pounds, which is significant. And even larger number of those who were polled said about 67% said that they have significant sleep disturbances, which have been probably an impact of the pandemic as well. So given this data and statistics, I think it should become clear that we should really be thinking about the habits we want to promote and the kinds of goals that we should set for ourselves and to achieve a healthier lifestyle as we emerge from this sort of a COVID cocoon. And I don't think this is just a question for individuals to explore on their own. But in fact, as you know, we are seeing the light at the end of the tunnel. The pandemic is starting to sort of cool down at this point. You can see offices opening up, all businesses are sort of opening up. I think the organizations have to ask that and pose this question too. What do they need to do? So apart from, the individual responsibility and what we need to do, I do want to spend a little bit of time at the end from an organizational point of view, because I think many of clinicians who have offices and people are returning, or many of us are returning to hospitals or other practices or people in different businesses. I think it's important this reacclimatizing ourselves to the world after more than a year of quarantine. It's going to take a tremendous effort. And I think it will require expert advice. It will require time and, in fact, a lot of resources as well. So that said, let me try to focus on one word which I have used numerous times at this point, and I think is the hallmark of what we discussed, which is stress. I think, needless to say that stress is a normal part of everyday life, and everyone is familiar with the feeling of being stressed. And as unpleasant as it may be, I think stress is key to our emotional lives as well as to our own survival. And this physiological reaction, which we call as the acute stress response, or more famously as the flight or fight response, which is controlled by the sympathetic nervous system, I think is important to understand, because the mirror image of the sympathetic nervous system is what we call as the parasympathetic nervous system, which encourages our body to sort of what I call as the rest and digest. So if we make an analogy, and very easily put, I should say the sympathetic nervous system would be sort of the gas pedal, and the parasympathetic system should be the brake system. And the sympathetic system is actually very important because it's essential for human beings for survival in the short term. But the problem is what happens if you keep your foot on the gas pedal. That's the problem. And I think, unfortunately, when we have become fixated on our stress and keep our sympathetic nervous system engaged, we end up with notably higher levels of stress hormones in our blood. And this can lead not just to inflammation, but more importantly, I think, which we are now starting to understand with COVID, neuroinflammation. And as the name suggests, I think this places more stress on the brain, which causes more stress hormones to be released, and this vicious cycle begins anew. So what researchers have been looking at, I think, for a few years, and we're continuing to find more and more now, is that neuroinflammation is associated with symptoms which we're starting to realize with psychiatric issues, particularly anxiety and depression, and a host of other physical problems, which I think you can look at the slide and sort of go down the list. So while there is no simple cure for stress, I should say there are some techniques to counter and at least mitigate the stress response through the practice of wellness. Or as I would define it, I think you can say practicing healthy habits on a daily basis to attain better physical and mental health outcomes. Now, in the context of this kind of a persistent stress that we face, especially during the last year in the age of COVID, I think wellness is specifically concerned with changes in lifestyle that mitigate inflammation, improved mental health, and it requires a balance of the sympathetic and parasympathetic, the gas pedal and the braking system in our body. And none of the things that promote wellness, I think, comes as a surprise to you and me. Things like meditation and yoga have been, in fact, data has shown reduce the levels of stress hormones. So it's not just, I think, just a cliche, but really physiological changes happen in the body. And the same is true of exercise. In fact, Kaiser Permanente did a study of about 50,000 adults that was recently published in the British Journal of Sports Medicine. And they reported that individuals who were engaging in about 150 minutes per week of moderate to vigorous exercise, in fact, at far lower rates of severe COVID infection. It didn't prevent infection, but they didn't end up being on ventilators or in ICUs or requiring other interventions. They were sort of able to cope better. And now, how much of that has to do with inflammation? I think anyone's guess, but you can hypothesize that, I think. And similarly, eating, healthy foods like fruits and vegetables has also been shown to, in fact, reduce inflammation and stress. So I think we know how to promote wellness. The problem is we don't, and that's a big issue. So on the one hand, adopting a wellness routine, that takes these lifestyle changes to heart is far easier said than done. I think evidence has found that it's more difficult when we don't have a support network to help. And this is an extremely important point. I think, in fact, Vikram had pointed this out as well, the social and the support network that is essential. And that keeps us motivated. Just in the context, we as individuals, human beings, are social animals. We have always thrived in tribes and, with people around us who give us validation, a sense of confidence and all of this. So I think it's important to know that. In the case of COVID, I think many people found themselves relying on this very unhealthy coping mechanisms to make it through the pandemic because they were alone. And many may be unable to even recognize that coping mechanisms have turned into a problem over time, precisely because they've lost this social support network due to social distancing, what I call as, in some ways, a forced a quarantine on people that was for reason that, that they needed to be confined because of the risks associated with. But psychological issues, yes, that's been there. Now, furthermore, people have lost a sense of urgency in making the change because a clear line of demarcation that signifies the end of pandemic, I think it's difficult to materialize or may never. And this notion that I'll stop tomorrow, I'll stop once things get back to normal, this cycle can go on indefinitely. So how do we interrupt these behaviors and adopt a wellness routine? I think the first and foremost, one needs to be aware that they are happening, they're occurring. There has to be some level of objectivity in that. And it becomes difficult when you are alone, but there are other people around you, obviously they can give you feedback. And I'll give you an example from my own practice. It's amazing to hear patients talk about their drinking habits, for example. And many of them, you ask them, if they drink, the answer will be, well, yeah, a glass occasionally like other people do, socially. But as I get to know them through their stories, and it tends to involve, more than a few glasses of wine, and their social life is actually seems to revolve around alcohol a lot. And people who were drinking a glass of wine over a period of weeks went to 2 or 3 and 4, and now it's like a bottle of wine, and they don't even realize that. So when you make generalizations about your habits to yourself, you often paint a very idealized portrait of yourself. And when you have to look at the specifics, then, you have to be honest with yourself. It is far more difficult to continue viewing your behavior through these rose-tinted glasses. So I would say, consequently, when you ask people direct questions, as we psychiatrists and mental health professionals do, sometimes it's helpful to utilize certain questionnaires, and you can get a much better response. So let me mention a few questionnaires that can facilitate a more accurate response and help individuals sort of jog their memory and function as a springboard to recall their symptoms. And you can see the links to these in the chat, in fact. And the first one is the patient health questionnaire, which is PHQ-9. I think a lot of people are familiar with, which mental health professionals, psychiatrists use to assess whether a patient is depressed or not. And because I think we don't just ask our patients, are you depressed? That really doesn't get, because of very general questions. Rather, I think we focus on symptoms, things like appetite, sleep disturbance, decrease in pleasure in doing things. So I think that's important. And furthermore, other questionnaires like GAD-7, Generalized Anxiety Disorder 7, which is very good for assessing anxiety, and the US UCLA loneliness scale can help individuals, in fact, take the first step, at least in recognizing, in making a positive change, because they can recognize these problems. So moving on, once a patient has recognized the problem, I think then they can move into this step 2, which is preparation. And this means learning how to implement a healthier lifestyle choice and deciding which ones we believe will suit us the best, because there's no one size fits all. And we then have to devise a means of putting this plan into effect, which can lead to the third step, which is action at that point. So, and I found that the best way to do that is to start slow, baby steps. And this means setting a realistic timeline that incorporates a lot of small achievement or micro wins. As people are returning to the offices and I'm seeing people, it's like, don't just start going 5 days to office immediately. Maybe, you start with a day at the office, a few hours, social distancing, just be careful, because people have all of these concerns. And then from there on, you can begin and start and take on, more days. So a micro win, if you think about it, what I call is a sort of an actionable behavior that will not immediately lead to this radical transformation, but at least it can build some confidence and some momentum in people. And it could mean, for example, on a physical basis, taking the stairs instead of elevator once per week, and then moving to twice a week or so. From a food perspective, you can say it could mean eating a vegetarian meal once per week or so. The idea is to sort of start slow and to build, because the ultimate goal is step 4, which is sort of maintenance. And maintenance is exactly what it sounds like. It means avoiding unhealthy habits and keeping the healthy ones. And this is because, and this is an important point, wellness is as such not a goal. It is a process that requires a very long-term commitment to self-improvement. And as I mentioned earlier in the talk, that so far we've been discussing from an individual perspective all of these things. But obviously the individuals, as the pandemic is receding, are going to come together. And there's going to be sort of a collective sort of, as you can call it from a mental perspective, consciousness, or a collective sort of decision making. And that's where the role of this umbrella of organization comes in, and what roles they can play to help all these employees or individuals, which will help empower the individuals to sort of continue their journey as they decided, but there will be sort of an overarching change, positive from an organizational perspective, that will help them a lot more at that point. So organizations will and can play an outsized role in helping members of their team play actually maintaining a lifestyle that is centered on wellness. And I think they should feel, the organizations, I should say, should feel compelled to do this. Why? Because it will help them retain the most talented employees. It can help improve productivity. It will help them prevent mistakes associated with burnout, which is extremely important, I think, because we are recognizing that, and is obviously is differentiation from the depressive disorder. And it will also cut down on the healthcare costs and sick days. Now, there are hundreds of specific things that organizations do. I am not going to get into those, but they all center around one of 4 central ideas. Encouraging healthy habits is one, discouraging obviously unhealthy ones, and creating spaces that allow support network to thrive, and also offering direct support to employees and their families as well. So the first and foremost, I think, straightforward, is to sort of encourage healthy habits by either direct or indirect methods, by fostering an environment where employees voluntarily participate in healthy promoting activities and programs. I don't think it's helpful at this stage to require involvement or persecute those who don't take part in them, because we don't want to sort of pathologize everything that people do, and that's very important. And I think if you think about it, for an indirect way would be to create a nutritional education program that employees can learn about on their own time. And one example is this ALIVE program, ALIVE, which is an acronym standing for a lifestyle intervention via email. And the study was done, which showed that over a 4-month period, the participants' diets and rate of physical activity, in fact, improved compared to the controls. So these kinds of programs would be, I think, ideal for remote workers. And a more direct way, I think, of encouraging a healthy eating habit would be to host a walkathon or 5K, some sort of a similar event like that. Now, that's on one end. On the other end, I think we can implement an indirect and direct means of discouraging unhealthy behaviors. And studies have found that decreasing the cost of healthy foods, which can be offered on site, and while keeping the less healthy options practically at the same current prices, can lead to healthier food choices. And in fact, data has shown that it doesn't have to be a big number. Even reducing the targeted food prices of healthy foods by only 10%, they saw that was enough for people to make a notable difference in their choices. So discouraging unhealthy habits also extends beyond this so-called diet and exercise, of course. And so organizations, companies, businesses, I think, should strive to prevent employees from overworking, because there's a clear correlation between a job strain and working overtime on one hand, and an unhealthy diet, a lack of exercise, obesity, cigarette smoking, alcohol use, you name it, on the other hand. And so such a demanding schedule can make wellness impossible. And it's important because people are returning, but their kids may still be, some may be home, their parents may be in nursing homes, some may be sick, they have a lot on their mind right now going on. So I think if it's, all engines blasting, probably it's not the best way. And I think that's very important to take that slow and steady approach. Now, thirdly, organizations can create platforms that allow, I think, people a space to form sort of bonds and social networks. And I think, as I mentioned earlier, that lifestyle changes are not easily made, and being a part of a larger network, in fact, can help you keep motivated or help with high stress jobs. And furthermore, being a part of a larger group can, in fact, sort of fight these feelings of loneliness and sort of foster this warmth. And even if people are virtual networks, it doesn't make a difference at this stage. I think the important thing is having that network. And finally, the important thing is that organizations can, I think, simply offer additional resources to employees to sort of help them shoulder some of the burden that prevents a healthy work, sort of keeps the healthy work-life balance. So, even in pre-COVID times, stresses that are unrelated to work have a tendency to remain on our minds. And while we should be, I think, focusing on work projects, I think it's important to keep that balance. And one prime example is food preparation. And it was very interesting that there was a study done where a Danish research project provided healthy, ready-to-eat meals that employees could, in fact, take home and eat for dinner. And it found it actually helped a lot with the work-life balance, because they didn't have to worry about food preparations or when they got home, and they were a lot more relaxed and they were a lot more fresh when they came back in the morning. So providing these kind of direct resources to employees can make them not only happier and less stressed, but more focused on their work and be more productive. So all in all, I should say these techniques will sort of create conditions which are more in accordance with individuals' needs, resulting in a happier, healthier, and less stressed out employees. I think those are some of the strategies, and I think we can go on, but I want to give Vikram an opportunity and all of you to sort of be a part of the discussion, have some questions. So I'll end there and going back to Vikram.
Thank you very much, Dr. Ahmad, for a fascinating and absolutely timely presentation that I think speaks to questions that all of us in some way, shape, or form are dealing with right now. Before I jump into the Q&A, I want to remind our attendees that you can type your own questions into the Q&A part of the Zoom, so please do that. I'm going to begin with a few questions of my own, and then we'll move to attendee questions. I'd like to start, Dr. Ahmad, with the social aspect. You stressed this in an early slide. It's something we talked about yesterday as well, that dealing with stress, developing good habits, developing wellness is not an individual activity. It has to be done as part of a collective, as part of a social network, which was very challenging during COVID for many people. People suffering from SUDs, for example, were not able to access their support groups. My question is, as we return to a normal world, do you think that we will return to the social context, the social values that we had before, or has something changed? We've spent a year and a half living fairly isolated, most of us, worried about our nuclear family units, very narrow point of view, not a broad point of view. To what extent do you think, as people go back to their lives, they will go back to the old sense of social responsibility, of group spirit, or will people be changed?
Question in the sense that I think there are a few answers to that. A difficult question to answer in the first place because there's simply too many variables and factors, in this. In the best case scenario, you do expect people to return to the norm at some point, whether it's in 1 or 2 years from now, anyone's guess. I think from a larger perspective, a lot depends upon, I think, the recovery, which is in some ways, I would say, economic recovery as well. And that requires, I think, governmental, non-governmental, public health, all of these places. But I think back to there's all
Dr. Ahmad, I'm just going to cut in for a second because I think there's some interference on your line and people are having trouble hearing. I'm not sure, something may have changed slightly.
Okay. Just see. One second. Can you hear me better?
Much better.
Okay. I think the important thing is that from a psychological perspective, there's always something good that comes out of the most negative experiences in life for us. And I think the main thing that I see that's important to realize is that a lot of us who were had lost social contact, and I mentioned this earlier, we are not people who live or as human beings who can thrive alone. We constantly need people. And sometimes being forced into a situation where you are alone, you begin to, in some ways, recognize and realize what you have been missing. We have been a part of a rat race. We caught up so much in our work, 9 to 9 or whatever we are doing. In that way, we are lost the center of what we need to be doing, which is our family and focusing on our own passions in life. And I think a lot of people had time to reflect upon that. There's no doubt. I mean, I see that in my practice every day. But the people who have been able to regain that are the people who have maintained those social contacts. Because you can think on your own, but you really begin to understand when we discuss these issues with other people around you, whether it's virtual or whether it's in person. But a lot of data is showing that people actually are changing jobs. People are tending to work less. People are willing to sacrifice their economic responsibilities in the sense of what they earn in terms of having a balance which is more related to their children and their wife or their husband or family or whoever they have in life. And I think it's a function of realizing what had been going on in their lives. And actually yesterday on television, there was an interesting report where people, in fact, banks were offering so much money to their employees and they were giving up their jobs, which was unheard of before, which is people are saying, no, I don't want to work anymore this much. I'm rather take a slice of my money and I would do that. And that's the good thing, I think, which has come out of this, that people have started to really realize the necessity of what I call is that nuclear structure. Because we have, if you look at the data, for the last 30, 40 years, we had lost that nuclear structure, the nuclear family. And that's a function of, it's another debate. But I think this pandemic in some ways has brought back the need for that nuclear family and that nuclear contact. That's the good that has come out of it. But as you well pointed out, some of the negatives are very much there. The substance use significantly went up, and it will take probably a lot of work for people to recognize, realize, and come back. I mean, in 1 year, there were 87,000 more deaths secondary to overdose. That's a huge number if you look at the chunk of people who died, accidental or not, but those were the number of deaths that have happened. So how do you rehabilitate that kind of substance use and get people going while things are still not open, and how that recovery can take place? So I think it's going to bring a lot of resources, but mental health resources in whatever shape or form probably are going to play the fundamental role. I think for a long time, we have been focused so much on the short-term physical, which is absolutely important, but we are losing sight of the neuropsychiatric sequelae, which will take years, if not months, to actually recover from.
That's a really encouraging answer. It's a fundamentally optimistic view that you think we'll come out of the pandemic with stronger social values, actually, because the pandemic forced us to reevaluate what's important in life. That's an encouraging vision. Let me turn to a few other topics, and then we'll get to the attendees questions. Focusing on the workplace. You touched on this a little bit, and actually also in private life. You are a professor of psychiatry, and yet you focused fairly little on that in your talk. You spoke much more about holistic things that people can do in their lives, their diet, their exercise, their sleep. It's an interesting contrast. You did not speak very much about how psychiatry and access to psychiatry and the importance of that is central to our recovery and dealing with stress. What is your perspective on reconciling those two things?
I think, it's important to realize that you can't look through a very myopic lens. Yes, psychiatry, I think, has sort of gone 180 degrees. It started from sort of understanding the psychosocial aspects of one's life, where we did not have all the biological evidence and the treatments at one time. And then as the fulcrum and the compass changed, now it's sort of gone the other way, technically, where everything is through the lens of pathology and through brain scans and mapping the brain. And we are becoming a pill-popping culture where we will find that as soon as we suggest that we are struggling with something, that struggle is pathologized in some ways. And we have to have an answer for that. It's a bigger debate how, from a treatment perspective, it is so, because you have to justify what you are doing for the person. And that's a completely different debate. But, if you look at from the perspective of how to help an individual in that way, I think that's a very myopic view in that regard, because we are sort of a much bigger than that. And I think going back to our inner strengths, which we derive from not just from purely biological treatments, but from the essence of people around us. I think in ancient cultures, actually, if you don't mind, I'm going to go on a tangent just to tell you how important that is for a moment. I was working in the earthquake zone of Pakistan after the earthquake, where it was a devastation. And I was in a small village, and someone was telling me where a school had fallen and 40 children had died. And these parents had lost everything. And this was a remote village where was the one social worker there. And he was telling me that people were sort of walking in just a haze because they didn't know what to do. And the only way he was able to make a difference was in the center of the town to sit every day and bring people together, where they would all just pour out their hearts and cry and laugh and do things with each other. And someone would have a birthday or someone would have this. They would share pain and sorrow at the same time and have dinner together and this. And they didn't know each other. They were just doing that. And that was the healing process for people. Now take that as just as a micro example of this and apply it, because to me, pandemic as a whole, 600,000 people have died. We all know somebody who has died, someone who was extremely sick, someone who has struggled with it. We do need to bring all of these elements into our lives to think about, how we can talk to someone. And that requires us to sleep at a proper time. It requires us to eat at a proper time. It some main rhythms in life that are a part of who we are as human beings. And to neglect that, I don't think any just medicine is going to help you with that goal, particularly if you don't want to wish to pathologize, which is extremely important. 87% of the people have suffered from something that could be characterized as PTSD-like symptoms because of the pandemic right now. However, if you look at how many people actually suffer from that, 7 to 8%. So there's a huge resilience factor in human beings. And that's not because of medicines. That's a function of who we are as people. When we have those support networks, we tend to overcome the most adverse outcomes in life. And I think that's important. So I have learned in my 30 years as a practicing physician, I think, and my patients have been my best teachers that way, which is that it's not just about providing that one pill to a person. It has a lot to do with what I offer them on a day-to-day, my availability to them, getting their families involved in their care, teaching them about how to eat, telling them about their exercise routine, telling them about their basic lifestyle changes that play a fundamental role in this. I don't think this is any different from what I do in everyday life with the patients. So that's how I view this. Absolutely, that psychiatry is a very important part that gives me the compass to think through a very biological and holistic way. But I think we need to bring other aspects of life, which I call, into psychiatry to sort of help our patients.
Well, thanks for that. I'm going to move to one more question of my own, a bit of a philosophical question, and then we'll get to, I see several attendee questions building up, and so we'll get to that immediately after this. You talked about what enterprises, what companies can do to promote wellness among their staff. I think one of the really tricky questions as we move forward is going to be the role of the enterprise in our private lives. How far can and should the enterprise go in helping push, pull, incentivize, nudge us employees to live a healthy life. Certainly in the age when many corporations are thinking about ESG and trying to make very public statements about their values and their social values in the community and for their staff as a whole. What is the right balance point, do you see, to how far should companies go in finding techniques to promote healthy eating, to discourage smoking, and so on and so forth, to manage work time, to manage stress? How far should companies go in trying to help shape employees' lives in a certain way, in accordance with a certain vision, versus sort of leaving it to doing a little bit, but largely leaving it to individuals to sort out individual lives? It's a big political / philosophical debate.
No, it is. I agree with you, because I think, the first thing, depending upon where you fall on that spectrum, people can, on one end, question their right to be who they are, their right to be freedom in terms of whether they eat more or they smoke or they drink or they don't exercise. It's their God-given right in that way, if you want to call it that. And on the other hand is, no, if you are a part of an organization, it's a shared burden, then you have to share that burden. Example, if it's $10 in a pool and they have to be distributed for someone's wellness or food distribution or health among 10 employees, each of them, and 5 of them are not using any at all, and then it's only going to the 5, then why would the 5 just try to compensate for the other ones? Why don't they pitch in at the same time? What incentive is there? So incentives are extremely important. What the incentives will be, I think each organization it depends upon where people are and what they work and how they do it. The second part, which I think doesn't happen much, but I think whether it's psychology or psychiatry or industrial psychology can play a role, is, in my opinion, is having some sort of a forum within organizations where people need to come on a regular basis to have some sort of a process groups, whether it's of 20 people or 100 people or 50 people, to develop, to have these debates and struggles. Because organizations, you can't leave it to an HR or to leave it to the top man to just make a decision and rule over everybody. I don't think that will work. I think it has to be a little more democratic process than that. I'll give you an example. I work in a hospital setting in a unit where there are people from all diverse backgrounds. There are 30, 40 people have to make lots of decisions. And we have a process group at the end of it, which is people can come and struggle and fight and argue and this. And at the end of the day, we know that we are all working towards a common goal. But there is a healthy debate about it, and we all come to some agreement. And of course, majority rules. But if that's the rule, that majority will rule, then there has to be a debate about it. That's it. And I think that's how organizations should play a role. Now, particularly how from a pandemic's perspective, they should play a role, whether we are talking about, people wearing masks or people having vaccinations or people not being allowed in or out based on this. I think, again, it's a function of that culture of the place or environment where people are, and that has to be an internal debate or a process group. But someone has to facilitate in an objective way. And I think it can be done virtually. And I've been actually having this discussion where, many of the psychologists, mental health professionals can actually play a very active role in helping facilitate such discussions, because I think that will really help the organizations come up with this philosophical question.
Well, thanks very much. I'm going to move now to attendee questions, and I'll start with this one. Hi, as a clinical director, I'm really struggling with negativity in my team. I fully acknowledge the pace of change and that we will never go back to the good old days. My own approach to change has always been to see it as an opportunity. It makes me avoid the staff as the negativity is becoming pervasive, even to the point of blaming the patients for their frustrations. How do I fix it?
Okay, so I'll make an analogy with so I work in a place where I deal in an inpatient unit. There are lots of staff. There's a lot of splitting because of the patients. People have very diverse viewpoints. People blame, you didn't do this, you didn't do that, and this. And the only way, and someone tells me this and someone tells me that, and I am the unit chief. How do I handle? The whole handle, I don't bring just two people in. I actually bring the whole unit in. And I said, let's have an open discussion to sort of figure out what are people's struggles? Where do you find things are not happening, or what change do you expect? What changes are not taking place? What people are saying or doing that some people like or other people don't like? Some people make a list of these things they bring in. Or sometimes what I've done is we have an empty sort of a box in which I say, just put in your recommendations, what you like and you don't like with this. And you don't need to sort of make it generic, so you don't identify yourself with that. And we will open it up in front of everybody and bring up those questions. And we can answer those questions as to that, and that will lead to a very healthy debate. And that's been, it seems very simplistic overall, well, yes, but in my opinion, it has been an extremely positive dialogue. Yeah, people roll their eyes and, it's like, why is that really a question? But you know what? Yes, it's a question. Somebody has a right to ask a question. And then you can debate it, struggle it. And in my opinion, a lot of people have been able to get answers. People said, oh, I never thought of that. Yes, now you can think about it. It sort of works as a springboard, as a foundation. For me, those kinds of discussions and those kind of strategies have been very helpful as the running an inpatient unit with a lot of people, where I think being a medical director is sort of in the same role.
Thanks. You're pointing to the importance of engagement. However difficult the situation, the only way through is to acknowledge it, engage in it as a team, and talk through it, and hopefully find answers. But that's very difficult to do. There are lots of reasons not to, on a daily basis, there are lots of reasons to avoid engaging with difficult questions, particularly with colleagues and so on. It's unpleasant. It will lead to conflict in the short run, and so on. What is your advice to people who are in professional environments needing to do what you're saying, finding it difficult to motivate themselves to incur that turbulence?
As they say, when the going gets tough, the tough get going. I struggle with it's unpleasant. It is. I have sometimes people that I know really well. I have known them for years, and sort of I'm in a role where I'm not just a friend or a colleague. I'm also a boss, and it's a very tough call to make. I'll be honest. I will be the first one to admit that, but it comes down to that, which is I have a closed door conversation with people to say, we need to speak and we need to talk. And this is just being a friend, as a friend, as a colleague, but also as somebody who has to walk a line between being a boss and all of the things. And these are kind of things that have popped up. I want to understand your perspective. This is not a conversation to blame you. This is not a conversation to sort of say you are wrong. No, this is a conversation to understand your perspective versus another person or 5 other people who have complained or do this. Let's have a conversation about it and move on from there. I can't say that I never will say that it's an easy conversation. No, it never is. But that's the only way you are going to, because otherwise, having an ostrich syndrome, you dig your head in the sand and think life is wonderful outside, that just makes things a lot worse. And we have seen, this is one example of what the pandemic has done to us. We are socially isolated, we are by ourselves, and look where it's ending us. More anxiety, more depression, because we're not communicating, we're not talking with people, we don't. And sometimes, in fact, as I said earlier, confrontation or talking about it, even though it's unpleasant, in fact, will lead to better outcomes. I mean, how many times have I done couples therapy with people where husband and wife sit there and argue with each other and fight with each other? But what they learn is that actually there is a positive outcome. They're able to walk away knowing how to communicate at times out of that in some ways. So, it's just sort of one of those things which one has to just take into account that, you just need to have a conversation.
Thanks for that. And I'll add one thought. I suppose that practice makes perfect in this. The first time you confront a difficult conversation, it's difficult. The second time it's a little easier. The third time it gets a little easier. And so I suppose the key is to do it as often as possible so that it becomes a lower bar, becomes more natural in the context of an organizational dynamic.
I think you're absolutely right. But the important thing is you need to let the person know that you are doing it in a very private forum, in confidence, in trust. It's not going to go outside the 4 walls. And that's your goal, which is, whatever is there, you need to understand and they need to understand. And then it's your job how to disseminate it in a very appropriate and what way. But having that trust is extremely important. Otherwise, nobody's going to talk to you. So I think each individual needs to understand that your conversation is private and it's, you will keep it to yourself and sort of take it from there.
Good. Another attendee question is asking us to speak more about individual physicians. We've spoken now about organizations and how organizations should think about supporting their employees, but individual physicians have just undergone a period of incredible stress. We all have in this society, but nobody more so than clinicians who have been on the front line dealing with patients, dealing with levels of mortality that they've probably never encountered before. You and I spoke about this a bit yesterday. The level of PTSD for clinicians over the last year must exceed that even of the general population. What recommendations do you have for individual physicians to manage themselves back into a state of wellness as we try to move on from the pandemic, as we try to return to a state of normalcy?
I think I'd mentioned this before to you, which is we started with a program in the hospital called a Battle Buddy program. Sort of the idea was actually from the PTSD perspective, with a battle buddy. The pandemic is like a battle for you. And I think early on we recognized that you need a sort of a listening ear. You need someone who can comfort you. And it was left open, whether it's a peer, whether it's a colleague, whether it's a mentor, no matter who it is, you choose a person of your choice in that way. But somebody who is available to you, somebody that you trust, and somebody who can sort of be that listening ear and comfort you, whether you meet in person, in the hospital, outside, wherever, but somebody who understands the dynamics of the workplace. So it had to be a workplace person. It's not somebody you pick in your personal life out there. And on a day-to-day basis, people who were struggling with it as they were going through it, they could reach that person, which was a way to sort of not negate, but I would say minimize the impact of that trauma, because as it's happening, you are dealing with it. So you are less likely to end up with significant consequences or sequelae in the long run because you are managing it. However, if you don't, I think still in the later stages of it, I think having somebody in that regard has been extremely helpful, but you can't keep it to yourself. I have had many, colleagues who have come to the office sort of started crying that I was working in the ICU, and I saw so many people. This person died, and that person died, and he was so young. And I saw there was nobody. I held their, held their hand, and nobody else could come. And they haven't seen so much death in their entire careers. And these people who have been working for years. Actually, they've never seen so much death in their life. What they saw in 1 or 2 weeks, in fact. So from that perspective, that's been one thing. The second was on that individuals would sort of get together, in fact, a few of them, depending upon what they were doing, and just sort of not from a deeply psychological perspective, but sort of in a very casual way, sit with each other and talk about what their burden of the day was in terms of what they had seen. And what was it like, and how it was impacting them. They have not been able to go home. They have not been able to see their children. They have been staying in a hotel because they're sort of in a risk factor, and all of this. They haven't seen anybody in a week, and they just keep coming back and forth and shuttling or sleeping in there. That was extremely difficult. But that was the only way that people were able to get through this, which was having that social support network and identify even one person of this. I spoke with numerous people on my own who would speak to me and just talk about, Simone, you have a few minutes. I've always had minutes. Sit down, talk to me, tell me what's going on. And they would call me on the phone or have a FaceTime or be in person with me. All of these things would happen. So my, sort of suggestion to people is, including myself, which is this is the kind of stuff that we need to be doing for our colleagues, for ourselves, even at this stage of this, because it's not over. The impact, what we have gone through is significant, but don't underestimate our resilience potential. As I said, 85% of the people go through these symptoms, but only 10% or 8% actually come up with a so-called diagnostic picture of it, because more than 90% recover from it. So, everyone, I need to assure that you just need to have someone and the ability to continue to sort of discuss and speak and open your heart out and have a colleague or a peer, someone who is somebody that you can confide in, and do not pathologize your struggle. It is not a pathology. If you weren't feeling this way, I would say, what's wrong with you? Feeling this way is human. It is okay to cry. It's okay to have pain. It's okay to feel scared. It's okay to be fearful. All of those things. It is absolutely normal. And the more you recognize that these are normal, natural human feelings, the less you will actually carry the burden of this and be more sort of open to acceptance and be let it go. That's how I see it.
Good. We have time for one more question, and there's many questions that I can't get to them all, but I'll end with this question for you. It's about trust, which I think we've spoken about. You talked about managing difficult conversations in the office requires trust. Social networks require trust. We talked about how you believe that people have recommitted on some level to the importance of our nuclear communities and our nuclear families. And yet a couple of questioners are pointing out that from a broader societal perspective, trust almost certainly is lower now than it was a few years ago, for many reasons. The pandemic, vaccine issues, we have political divides. Without getting into all of these, there are many reasons why it seems that broad trust is maybe under threat. How do you see it? And what impact does that have on wellness long run?
I would say it has an impact. There's no question about it. I'll start with an example where a patient of mine was discussing with me and struggles at home and was asking me, he said, what is your perspective? Because I'm very skeptical about vaccines, and do you believe in the vaccines? That was the question. You believe? It wasn't, as a doctor. And my answer was really, which was, you have been working with me for so long. Do you trust my judgment? Yes, I do. Do you trust my scientific viewpoint, what I bring to you in terms of the treatment and what I do? Yes, I do in that regard. So I'm going to talk about, from a science perspective, what I can tell you the risks, benefit, ways, all of, how to weigh them in that, and ultimately decision will be yours. But, so if you trust me, these are the two sides of the picture that I can give you and I can present you, and then you can make that decision. And without any judgment that person didn't believe or didn't sort of was skeptical about it, I did not make them feel that they were wrong. My idea was to be extremely neutral and empathic in that way, to say, I understand where you're coming from, and I'm going to give sort of a very unbiased, balanced view for you to make that decision about how you want to do this. And I think that's one way that I suggest. I have this conversation every day in the hospital, where about, I would say 40-50% of the people sort of don't want to do something about, treatments about pandemic, of how to prevent or what to do about it. It's a question of trust again. We don't trust what the message is in this way. And without any kind of a judgment, which is in a very warm environment that, yes, look, this is what I have done, and this is how I made a decision for me. I never say, you need to make this decision. I always bring myself into the equation. I said, I'll tell you what I did and why I did. I think because when you put yourself in the driver's seat, in this hot seat, and you admit to why you have done something, it makes people feel more comfortable that you are not telling them to do something, but you are leading by example by saying, I have done this by this. You can take it or leave it. It's your choice. But these are my reasons in this. That's the way I have been able to help people make decisions and foster trust with people, which is not say, you are right, you are wrong. No, this is not this way. No, this is not that way. No, I'll tell you, this has been my struggle. I am also a human being. This is how I have made these decisions, and this is what went into my decision making. And that's how I have been able to have these discussions, which have been very difficult at times. They get, I've watched them get heated in an environment, whether it's about masks, whether it's about vaccinations, all of these things. People bring all kind of, racial or political or all kinds of different views, and you don't need to sort of get into those racial and political. That's not a part of building trust. That's going to break trust. In fact, you need to stay away from that discussion. You don't need to address those things. Your job is to sort of just be more scientific in that way, be warm, be empathic, because I think as psychiatrists, mental health, we are at the forefront more than any other specialty of being able to make people understand the science and yet being able to work with them in a psychological, warm, empathic way. We can have that discussion, and nobody else is as trained as we are in that way. So I think it's incumbent upon us, I think, to take on that responsibility.
Well, thank you for that affirming answer. Thank you for a fantastic presentation today. I enjoyed it. I'm sure all of our attendees enjoyed it. And with that, I will thank the attendees for taking an hour out of your day to spend some time with us, and I will hand it back to Connie.
Thank you, Vikram. This concludes today's webinar. You will be receiving an email with a link to today's webinar recording and a brief survey for feedback on today's session and suggestions for other topics you would like to hear about from us. Finally, please keep an eye out for an invitation to next month's Expert Insights webinar on using simulation and digital tools to effectively teach clinical skills. Thank you for attending. You may now disconnect and enjoy your day.